Good morning, good morning, good morning. Welcome to Mobility Magic on a Monday morning at 11:30. It's a bit overcast and grey, but we're going to have an awesome time doing some Mobility Magic first thing on a Monday at 11:30. So, hello if you're joining us for the first time. If you're joining us for the regular slot on 11:30 on a Monday, but it is Mobility Magic, and today we're going to work through some shoulder, chest, neck, and a little bit of upper back as well. So you need a lacrosse ball and a foam roller. If you do not already have those, then please feel free to grab them. And if you have any requests or anything you'd like us to cover in session, please leave them in the comments of the post the video we'll put up afterwards. And apologies that last week's video went up a little bit late. There was a couple of technical difficulties, but they've been resolved now. So just going to give it about 30 seconds, then we'll turn the chat off and we'll get straight into the session. So again, a little bit of neck, a little bit of shoulder, and a little bit of upper back as well. And you will need a lacrosse ball and a foam roller. So if you don't have those things, you may wish to grab them if you want to participate in this. And if not, then feel free to watch along and hopefully you find some interesting and useful kind of tidbits that you can use yourselves. So I'm going to turn the chat off. We're going to get straight into the session. Welcome everyone, as I said, and hopefully you enjoy this one. So first thing I want to do is a check-in. We are going to look at a little bit of neck and shoulder. Just want to kind of see where we're at, see what we can do to address those things. So first thing we're going to do is we're just going to start with a little bit of a neck rotation. So you can either do a 360 round or you can do like a half circle. Just to kind of see. As you do that, I want you to make sure that your shoulders are pulled right down behind you. So you take any tension from your shoulders, because it's actually a little bit more difficult. If your shoulders are in your ears, it's more difficult to do that rotation. So again, we're just going to pull our chin back and we can go back the other way. Now we're going to roll the shoulders back and down, but again we want to lift up as high as we can, as back as far as we can behind us, and then down as low as we can. Bring it forward, back, forward, back. So again, we're just getting a little bit of motion in the shoulder. We're just checking in to find out where we're at, and then we're going to do a little bit of a neck stretch as well. So now we kind of got our neck and shoulders kind of loosened up. We're actually going to do a little bit of an SEM stretch. So SEM, sternocleidomastoid, like a little bit of a ropey muscle on the front here. See it kind of pop out just here, or if you turn your head. This is going to take some tension off the front of our neck. So and also laterally as well. So you're going to want to put a kind of a thumb there. You're going to kind of grab it a little bit, and we're just going to add a little tiny bit of pressure. So you don't want to squeeze it. It's not like the death grip on it, but it's a little bit of tension. And all we're going to do is just start to tilt our head away as we kind of grip that little rope-like structure that's there in our neck, and we're just leaning away. So you can apply a little bit more pressure as it goes along. We're just trying to loosen it up gradually. We're not looking for like too much pressure. Again, not the death grip, just slowly releasing it. And once you've done it a few passes, you can just see how your neck feels, and you probably feel a little bit looser on the one side now that you've kind of taken out this tension. So let's do the other side. We're gonna, again, take our thumb, we're gonna turn our neck a little bit towards the shoulder, and then should let it pop out into our fingers. And once we have that, apply a little bit of pressure, so we're just squeezing between the thumb and the forefinger, and we're just starting to lean our head away slightly. Not too much pressure, but enough to start to tease that tissue and ease that tissue as well. And we're just starting to lean away, and you can reapply as well a little bit further up if you want to. Again, if you need to get hold of it some more, you can turn your head, it should pop out. And we're just leaning our head away. And again. Awesome. So you can do that for as long as you like. You can do that a few more passes. You can apply as much pressure as you need to. Probably about 6 out of 10 in terms of pressure is good. And you probably find now that if you were to tilt your head, you might find a little bit easier, even turning left and right. So next thing we're going to do elevated scap stretch. We're also going to do a modified version in a minute with the lacrosse ball, so you'll be able to see if that helps you at all as well. So we're going to bring our arm behind us. We're going to bring our head down towards our armpit. So we're actually going to turn our nose towards our armpit, and then we're going to add a little bit of traction from the back of the skull. So we're just going to hook up above. Now we're taking our head up and over the top towards our armpit. So we're lifting up, over, down. And you start to feel a stretch in that shoulder and neck area. Without applying too much pressure, ease off. You're gonna rehook, lift up, over the top, down towards the armpit, and take a nice deep breath in. And now we're going to add a little bit of a push back into our hands. So we're going to do like a PNF or a modified PNF. We're going to traction up, over the top, down towards the armpit. But take a nice deep breath in. As we breathe in, we're pushing back into our hand. As we breathe out, we're coming deeper into the stretch. Do that one more time. Pushing back. Breathe out. Come down to that bottom pocket. Ease off. We're going to do the same thing on the other side, so we're going to turn our head to the left. We are bringing our right hand behind us. We're tractioning kind of up, lifting the head up, and we're coming over the top. So we're going to lift up, take a nice deep breath in, coming down to that corner pocket or down towards the armpit, tractioning up, down towards that corner pocket. Now we're going to apply a little bit of that PNF, so we're going to retraction, so we're getting our hook again, lifting up towards the bottom pocket. Going to push back into my hand on the inhale, come down on the exhale. And again, you should feel a stretch through the shoulder into the neck. That's what we're going for. You should also feel your shoulders start to loosen up a little bit as we get that muscle that connects the neck and the shoulder blade at least together. So next I'm going to do, we're going to grab a lacrosse ball. So if you have one to hand, grab one. And we're going to do the same sort of stretch of the ball. So for some people, this could be a little bit more effective. For other people, just that stretch alone will be worth it. And you'll have enough gains in range of motion for that to be effective for you. So I have a white ball. This is a white wall, but hopefully you can still see it. It stands out to you. So the idea here is I'm going to hit the same place that I just worked. So that spot on the shoulder. So if you just joined us live, you'll need a lacrosse ball, and we're going to put this on our levator scap, which is kind of at the top of the shoulder blade, kind of around this area also, and this is kind of between where the neck and the shoulder blade attach. So you're going to find the sweet spot for you if you need to do this, and it's just kind of at the top of the shoulder, kind of roll across, see where you need it. You might need to drop your hips slightly just to add a little bit of backwards pressure into the wall. And for most people, normally there's at least a spot of tenderness around this area. So probably going to want like a 6 or a 7 out of 10 in terms of pressure. We're just pushing our hips or shoulders back, hips forward, slightly bent with the knees, so we can add enough pressure if we need to, or at least modulate the pressure if we need to. So nice deep breath in, sink that pressure backwards, sink that pressure backwards, sink that pressure backwards, and we just start to move from left to right, up and down, up and down. Now, let's find a new spot, start to ease up a little bit. We can work around the shoulder blade if we need to, or you can just kind of find a spot further out. Again, we're focusing on the levator scap, so we want to focus on the point between the neck and the shoulders. And then if you want to, do the same thing you did just now, bring that arm around your back, and then head towards the armpit. You can also do that. And as you apply a little bit more pressure, you can do the same traction up to the top corner, and down towards the armpit. Moving with the breath. Applying a little bit more pressure if you need to. Now, second thing we're going to do here is we're going to do a little bit of arm movement. So we've done a little bit of neck, a little bit of releasing the levator scap. We're also done a little bit of the back of the shoulder blade. So we're now going to start to move that arm as well to try and tease that tissue open. So we can come across the body and come up towards the top corner. If you start to find the tissue release and it moves, find another position, come down towards the floor, and come straight up. if that spot kind of moves, then move with it, find out where it is again. Come down to the bottom corner, right hand corner pocket, let's say, up to the top corner. So we're drawing our sword and we're sheathing it. And then if you need to find that position, let's go ahead and find that position again. That kind of tender spot. Mine's moving around all over the place. Lifting up, just trying to stay on that spot, coming down towards the bottom corner. So let's move across to the other shoulder. So again, if you just joined us, I have a lacrosse ball against the wall. I am putting the ball against the wall and I'm applying a bit of pressure with my shoulder into the wall. You can use your feet in a bent position. Knees are going to be bent, I should say, and then we're just applying that pressure back into the wall. So a little bit of pressure. Now you can do this on the floor if it's easy for you. Some people find there's a little bit too much pressure though sometimes, but at least you can control the ball on the wall. And we're just going to start to find that spot that we want to hit, and we're going to add a little bit of a traction at the skull. So we're putting this arm behind our back. Once you find that sweet spot, traction up into the corner. We're just going to relax our hips down. Down. And now, once that's kind of released a little bit, let's try a different position. So you're just going to start to add some backwards pressure if you need it. Again, 6 out of 10. You can drive your shoulder back into the wall a little bit more if you need that, or you can relax off if you need less pressure, and you can even start to move around to find that next kind of trigger point if you have one. If you do find one, let's raise that arm up to the ceiling. Let's try and stay on that spot if you can. Coming down towards the floor, lifting up. Coming down. We're going to come across the way, so we're coming all the way out to the side, and we're bringing that to the bottom left-hand corner. We're kind of drawing that sword, bring it up. If you find that the spot moves again, you can then move to a new position. So if it's more kind of medial to the spine or it's more lateral, just kind of move where you need to go. So again, we're just trying to move our arm as much as we can to help that release in different positions. Okay, so now let's come down to the floor. I'm going to put our lacrosse ball away for a second. You may need it later, but for now, we're going to come down to the floor. We're going to do a little bit of a T-spine roll. So this can help with thoracic extension. If you're someone who struggles with overhead range, maybe this will also help you as well. So come down to the ground. We're going to support our neck if we need to. Because again, this can also be a little bit of, a lot of tension on the neck in this one. So we're just going to come down to a position where the foam roll is at the top of our shoulder blades. We can either support our head in this position, or you can cross your hands, or you can bring your hands up to help kind of steer the movement from side to side like a rudder. So we're just lifting our hips off. We're just going to start to roll a little bit. And if you need the support around your head, feel free to do that. Sometimes it helps to lift your head forward and bring your elbows in. And we're just going to start to roll gently forwards and back, a couple of vertebrae at a time, just to kind of see where our tissue's at. Now, if you want to give yourself a big hug, sometimes that actually helps to expose a little bit of the tissue of the erectors and just around the spine, and that can be helpful too. And once you get kind of more towards the bottom of the rib cage, you want to stop because you actually want to just focus on that thoracic spine. So kind of about mid-chest, just below where the rib cage parts, that's where you want to stop. So once you've kind of done a roll from top to bottom, we're going to start to go from side to side. We're going to start to rock and just open up each of the ribs just by rocking from side to side, a little bit of pressure, and then we're going to work our way down as well. And again, we're just focused on this thoracic extension as well. So find yourself in a new position, and we're going to bring our arms up and over. So if you have your hands on your head like this, and you're supporting your neck because it can be a little bit of pressure, you can always take a break for a second, and we're just looking to raise our arms up to the ceiling, and we're going to start to bring up our arms over the top as we start to tease, open that T-spine as we're stretching our arms back. We're just moving to a new position. allowing our weight of our shoulders and our arms to kind of help us to open up from this position. And if you're not quite ready for this one, you can just stay in this position and just kind of rock from side to side, or just reach up and just let your body weight kind of sink down into the foam roller. Okay, so we're now going to transition to a side roll. We're going to work into our lats, into our intercostals, and a little bit of our teres major and minor in the top corner of our shoulder. So laying across the foam roller, we're going to start at the very bottom corner of where our lats are. So we're going to need to turn our body slightly open. So we hit kind of the bottom of the lats, as I said. We're going to start to add a little bit of pressure by pushing our foot into the floor and working backwards and forwards a little bit, just to kind of help release the side of our body. So once you start to feel a little bit of tension, so let's say you hit a sore point or a trigger point, or even some tension at the tissue, you want to lift your hips up just a little bit, you want to stretch your arm out as far as it will go. We also may want to reach up to the ceiling and over, that can also help, but the main thing here is we're breathing throughout. So nice deep breaths in, sinking into it. We're just going to start to roll again, start to roll down, start to find out where that tissue is tight. And now I'm starting to find that, in actual fact, I'm a little bit tighter towards the top corner. So this is where that teres major and minor is. Also, if you have any issues with your tricep, this can also be a root cause there as well. So it's also worth spending some time in that corner if you have any issues with your tricep on the back of your, or any elbow pain as well. So we're just going to start to open up a little bit. Again, if you want to use your arm as a rudder to help you, that can also work, because you can also reach and do a little bit of a circle to kind of open up. So the bottom hand, the hands on the floor, is going to reach away on this one, and we're going to start to roll towards that top corner. So imagine just rolling some dough out, same sort of thing. We're just kind of getting that tissue to just disperse a little bit, dissipate, diffuse, whichever word you would like to use. So rolling a little bit again. We're now going to work our way back down a little bit. And on the back side too. Now, let's change sides. I'm going to flip over so you can see me. We're going to do the same thing, starting from the hip, coming all the way up to the top corner. So let's do that together. Again, starting with a little bit of pressure. Going to put our weight in towards the back side of our hip, more towards where the lat inserts. So we're going to reach up, we can support our body weight. We can even use our foot to modulate the weight. We start to roll towards the hip. So if you want to start more medial, so towards the middle of the back, we can have our hand up. We can start to roll, keeping our chest open. If you want to have more of a side into the intercostals as you come up into those ribs, then you might want to stay a little bit more with your chest down towards the floor. Either way, let's start to roll a little bit. Let's just kind of see how it works and which areas need more attention. So if you're someone who's a little bit more stuck in the lats, you may want to open your chest up a little bit. If you're someone who's stuck a little bit more in the intercostals, around the rib cage, and a little bit more into the teres major and minor, so you get a little bit sore more in the armpit, you may want to keep your chest a little bit more closed. So either way, let's add a little bit of weight. Let's start to roll. Start to roll towards that top corner, where that arm kind of meets the body. And we can breathe as well. And if you're someone again who has a little bit more lat, you might want to turn your chest open. It's going to hit the back side of the shoulder a little bit more. Or if you're someone who's a little bit more on the front side, into the intercostals and into that kind of front side of the scapula, you may want to have your chest kind of down towards the floor. Just a little bit of a roll. So again, if you want to kind of stretch over, you can. Using that arm to kind of help you move across through that shoulder, reaching forward and up. And you can even stretch that hand across the floor and stretch the arm over the top to kind of get more of a release from that area coming around. Awesome. So now we've worked through the T-spine into the teres major. Now we're going to do a little bit more of a release into the chest. So we're going to roll through the pec This, you can have yourself kind of laying down straight on the floor. There's a couple ways to do this. Ideally, you want to have the foam roller kind of diagonal angle, just so you get a little bit more of that pec minor as well. If you don't want to do this one, you don't have to. You can skip over it, and you can also skip ahead a couple of minutes if you're on the replay as well. So, chest is going to come down towards the floor. I'm going to face towards you first. I'm going to face away from you in the second one. Our hips want to be on the floor. I want to have a little bit of a weight into that shoulder just by kind of shifting the hips. You want to have your other hand down on the floor so you can pivot as well. We're going to stretch away from the foam roller, first of all. I was starting to turn our body, so my head and my hand, away from the foam roller. And I'm trying to put as much weight as I can into the top corner where the arm kind of meets the chest. And I should find right there, hopefully, if you're in the right spot, that maybe if you're somebody who gets tight across the chest, this is the area you want to hit. So we're reaching out. We're going to start to turn our body. We're going to see how that feels. If we need to add a little bit more of a stretch, I can reach my right arm out. The arm that I'm stretching, the pec that I'm starting to work on, and see if that helps. I can also try and lift it off the ground whilst turning my chest the other way and slowly lower it down towards the floor. So again, lift, turn, lower. Take a nice deep breath in. And turning, turning, turning. I'm slowly lowering down. I can also wave it up and down to start to get that to open up a little bit and the tissue to diffuse. So, switching to the other side, so you can see this side. You can see a top view. I'm bringing my arm across the foam roller and I'm reaching away. I want to turn my body slightly so I can put some weight into that area, and I'm going to turn my head as well. Now from this position, we're going to take a nice deep breath in. We bring our chest into the foam roller. I'm going to turn my body away from the foam roller. So it's a pressure comes down, turn our body away, and then we can lift up or stretch out towards the wall. So I'm stretching out, turning my body, and it can be a combination of any one of those things. So stretching away, turning our body, sinking in. Deep breath in, sinking down, and turning the body away. Now, I'm going to lift our arm up this time. Slowly lower it down, like we did on the other side. It'll lift up, turn our body a little bit. Slowly lower down. Again. And we can even wave our arm up and down. Now you can also move through each of the spots, kind of through this range, do the same thing, lifting up and then slowly turning our body. But for now, we're going to move on to the next stretch, which will be a little bit of a prayer stretch if you've done this one before, but we're just going to reach to the side. So coming down onto our knees, we're just going to come down into kind of a prayer position, but we're going to bias one side just to get a lat stretch. So reaching to the side. Going to sit our hips back, and we're just feeling out for a stretch. If you don't feel it, our aim is to get this side of stretch on my right side, coming across to my left. So I'm turning my body, my left hand and left arm is straight up. My other side, my right side, which I want to stretch, is kind of turned in slightly. And I'm sitting my hips back to get the stretch. So if you want to reach out, you should feel a stretch. Nice deep breath in. And let's come to the other side. So we're working around. We're using the arm on the side that we are looking to stretch. We're coming over in kind of an arch. So I'll turn to face you so you can see. So my first hand's coming down. I'm bringing my other hand across and I'm working out from where I want to stretch as I drop my hips back. So I'm going to come forward. And then coming back again. One more time. Awesome. Okay. So if you have a chair or a bench or a sofa, we're going to do a little bit more of a pec stretch using that. So this can also be done on a Swiss ball or any other kind of raised surface. So this I find works really well on a chair. So I didn't mention earlier, but if you do have one, this can be awesome. And all we're going to do is the same kind of position we did with the foam roller, but we're going to bring our chest down as we do it. So you can stretch your arm out as best you can. Often it helps if the surface is a little bit higher. But we're going to turn our body down. So we're going to drop our shoulder down. We're going to turn our body away, and we're going to drop our hips back. So again, we're dropping our arm either straight or at a 90-degree angle. You can do both actually, and that works efficiently. We're going to drop our body down towards the ground. We're going to turn our chest away, and then our hips are going to be what kind of helps with our chest stretch. So turning my body away, dropping my hips back and forwards, turning my body away, hips back and forward, and that's what's going to help with the chest stretch. So again, turn it this side so you can see from a different angle. My right arm is through this time. I'm putting it through the middle of the chair. This could be a sofa or an exercise ball. I'm going to drop my chest down, turn my chest away, and I'm dropping my hip forwards and backwards. This should feel a chest stretch. If you bring it to 90, you may find it's more of a pec major, straight, and you might find it a little bit more pec minor. So let's change sides. You can see from this side this time. Again, this is a good pec stretch to complement the release we did earlier. So we're going to start with a straight arm. We're dropping our chest down, and we're turning our body away, and we're dropping our hips back and forwards. And we're dropping our chest down, turning away slightly, and we're just fanning around to feel that chest start to open up. And we're dropping our chest down, turning our chest away to this right hand side, and I'm fanning to see if my chest starts to open up. If you want to switch to a 90-degree position, you can do that. Otherwise, let's move on, do a little bit of work on some wrist, kind of finger. So those of you who've done this before, there's a couple ways to do it. We're going to bring our weight up and over the top. And today we're just going to keep it nice and brief, but we are going to rock, keeping our shoulders stacked over our hand. We're just going to rock forward. So if I bring it to the side, so you can see, hand is coming straight down, or arm is coming straight down, sorry, with the shoulders straight over the top of my hand. I'm just rocking forward for a little bit of a stretch. As my body weight kind of sinks into the hand, I'm just rocking forward with my hips. So you should get a little bit of a wrist stretch, you should get a little bit of a finger stretch, probably feel it all the way on the underside of the arm. Just rocking my hips forward. We'll go to the other side, do the same thing. Shoulders stacked over hands. We'll come back to the left hand side in a second, I should say, but we're just stacked over the top. My shoulder should be straight, tucked back into my armpit, and now let's come back to the first hand. So my left hand. So we're going to apply that same pressure. I'm going to work through the fingers. So you can go little finger to thumb, or you can go thumb to little finger, but we're just going to lift up as I bring a little pressure forward. I'm lifting this thumb straight towards the ceiling. My thumb's then pushing down, relaxing it. I'm going to work around to the pointer finger, this index finger, and then relax. Middle finger, a little bit harder for some. Lifting up, keeping that body weight over the top of the hand. I'm going to go to the ring finger, and now I'm onto the little finger as well. So I'm lifting that little finger up, and I'm relaxing, just drifting in and out of a stretch here. Let's come around to the other arm. We're lifting the thumb up as I keep that weight over my body. That's going to be really good to relieve some tension in the forearms, especially if you're sat at the desk all day, if you're doing some typing or with a mouse. And then we're lifting the middle finger up and relaxing. Other side, we're doing the ring finger and then the little finger too. And then we're just kind of drifting in and out. So that was just a quick, brief kind of wrist release at the end there. Just going to do some wrist rolls just to really work out that kind of wrist area. But hopefully that kind of was a little bonus for some of you that stuck around there after the chest and shoulder release. So again, a little bit of chest, a little bit of shoulder. Hopefully you found that useful. If you're watching on the replay, hopefully you enjoyed the session. You'll leave a comment afterwards on the video that we post. So thank you so much for joining us. Same time next week for Mobility Magic. I'd love to see you then, Monday at 11:30. Otherwise, have a great week, and I'll see you soon. Ciao for now.